in the importance, first of all, of informed consent, specifically as it relates to this case?
Yes. Were there to be an informed consent for this case, it would have involved the fact that propofol is not a drug that is used for insomnia. It would have involved the fact that nobody has tried administering propofol night after night for the treatment of anything, except perhaps sedation in the intensive care unit. Totally different environment. It would have involved the fact that the risk of death was very real. There's no evidence that this conversation took place. There's no evidence that Michael Jackson knew that his requests for propofol was placing his life at risk. But that's what informed consent requires. Informed consent requires discussions of alternative therapy. There's no evidence that that discussion occurred. And it has to be written consent. Verbal consent is subject to the vagaries of memory or the possibility of the person not surviving. The consent has to be written. There was no consent, either the document or any evidence of a process of informed consent.
What is meant by a patient's right to autonomy as it relates to informed consent?
Your body is your own. Your life is your own. And you have the right to autonomy, to dictate what happens to your body and your life. That is a fundamental human right. Informed consent is medicine's way of respecting your right to autonomy, your right to make those decisions that are important and will affect your body and your life. Autonomy is a fundamental principle in ethics. And physicians, nurses, hospitals, healthcare institutions all recognize the patient's autonomy, the patient's right to make these decisions through the process of informed consent. The lack of informed consent denied Michael Jackson autonomy.
And would that informed consent in this case, under these facts, include the requirement that Dr. Murray tell Michael Jackson in no uncertain terms that he may die as a result of what was taking place with the propofol?
Yes. I tell patients when I take care of them that there is a possibility of severe adverse events. And that's in the best of circumstances, and that includes the possibility of dying. That's part and parcel of the anesthesia consent process. This case being many, many, many orders of magnitude different because of the environment, the doses, the lack of competence in either managing sleep disorders or these drugs, placed Michael Jackson at huge risk. And there's no evidence that that was disclosed.
And when you talk about the right to autonomy, and you previously talked about the doctor-patient relationship, you're not saying that the right to autonomy would allow Michael Jackson to insist on propofol, with the result being that Conrad Murray then has an obligation to provide it, are you?
A doctor's obligation is to put the patient first, which requires the exercise of judgment, requires saying no when it's appropriate. Saying yes is not what doctors do. Doctors do what's best for the patient.
And the denial of autonomy, the denial of allowing the patient to be fully informed about, in this case, the risk of death, that's one of the reasons you found it to be both an egregious and ethically unconscionable violation of the standard of care?
Yes. Every night there should have been a consent, an informed consent, a written informed consent for the sedation every night, because it's a new procedure. And by not obtaining it, Michael Jackson was denied autonomy. denied the right to know the likely consequences and for him, Michael Jackson was denied his right to make an informed decision.
You next talk, Dr. Shafer, about the requirement that Dr. Murray continuously observe the mental status of Michael Jackson. And you found that to be, again, an independent, egregious violation. What do you mean by the need to continuously observe the mental status?
When I am providing sedation to a patient, I'm right there, usually right at the head of the bed, unless for some reason they're operating on the patient's head or face, in which case I'm just to the side of the patient's head, but I'm right there. And I'm able to converse with the patient while they're getting sleepy. It may be that they're not fully asleep and that I can chit-chat with the patient. I can talk with the patient. If the patient is at all uncomfortable, I'll say, oh, that's a little uncomfortable. Okay, I'll give you something more. But I'm right there with the patient, assessing the mental status, assessing how awake they are, how comfortable are they. And in the case of using these drugs for sedation, we're not looking for unconsciousness. We're not looking for general anesthesia where you can cut a person's body open and not have them respond. We're looking for a amount of drug effect, the power of the drug. We're looking for an amount of drug power here that is just enough to have the patient where they need to be and not more. But to give just enough drug and not more, you have to know where you are. You have to know how sleepy the patient is and whether or not they need more drug. And you stay right there with them at the head of the bed constantly.
And in your opinion, did Dr. Murray violate this fundamental requirement for the safety of the patient?
Yes.
And would you characterize it as Dr. Murray having actually abandoned Michael Jackson?
Yes, he walked out of the room.
You gave an analogy in your April 15th report of someone driving a motorhome down the street. Can you describe that and relate how that applies to this case?
Absolutely. An anesthesiologist or a physician giving sedation is responsible for driving this case, like a person driving a motorhome. If a person's on the freeway and is driving a motorhome and decides their bladder is full, they need to leave, you don't just get up from the steering wheel, walk back to the bathroom, relieve yourself, and come back 2 minutes later, because it's very likely there's going to be a disaster.
Suddenly,